All right, thank you very much, Taylor. Appreciate it. And thank you all very much for joining us this morning for this press briefing on the state's response to the pandemic. As always, we remind people that the pandemic the virus is increasing in our communities, and we are seeing more community spread, and that's why we're asking people to step up and do more to be able to slow down the spread of the virus here in Nebraska. That means remembering that we want everybody to avoid the 3 C's, and that includes crowded places, close contact, and confined spaces. Again, this is a virus, right? It transfers from one person to another person. So in those crowded places, that's giving it an opportunity to spread from one person to another. If you're in close contact, and by that we mean that you're closer than 6 feet to somebody else who's not in your household for a period of more than 15 minutes, that's an opportunity for the virus to spread. And that's a great opportunity also to use a mask. You should use a mask in those cases. And then in a confined space. And again, when you're going to be, as we are all heading indoors as the weather is cooled off here, that gives more opportunity for us to be in those confined spaces with poor ventilation. So please try to make sure you've got good ventilation. When the weather's nice, open up those windows. That will help make sure that, again, you're getting good ventilation in there, and that will disperse the virus so that it doesn't have a chance to spread. If you can, again, we're going to have a nice week this week, and you want to see family members, doing it outside would be the best. It's going to be lower risk than doing it inside. So again, avoiding our 3 C's will help us. And then of course, we want to make sure to remind everybody about the other tools that we have to be able to slow the spread of the virus. To keep that 6 foot of distance between you and somebody else when you're going to be out in public, to make sure you're wearing a mask when you're going to the store, washing your hands often, staying home when you're sick is a big rule that we have. So even if it's just mild symptoms like you got a little bit of a cough or headache or a slight fever, stay home until you have the opportunity to get tested and make sure that you actually don't have coronavirus. Again, a lot of folks will have mild symptoms, and that's another way this virus spreads. So please stay home when you're sick. We want people to start such as we did earlier this spring. So for example, when you go to the store, just go once a week and go by yourself. Don't take the whole family with you. That's an example of how we can slow down the spread of the virus. And of course, with the Thanksgiving holiday coming up, we want people to think about smaller groups for the holiday. Don't get the whole family together in a big group. Try and break it up into smaller family groups. That will be a way that we can, again, slow the spread of the virus by making sure that we have smaller groups that will help us protect our hospital capacity. All this is around protecting our hospital capacity. Today we've got about, let's say, 30% or 20% of our hospital beds available, 30% of our ICU beds available, and 70% of our ventilators are available. And again, we want to make sure we preserve that. That's why on Friday, I put out the chart that shows the different levels that we're going to be at, whether it's yellow, orange, or red, or blue or green, and how many cases in coronavirus cases in our hospitals will put us at those different levels. We did see a slight decrease over the weekend with regard to hospitalizations, and then it picked back up again. So we're sitting at 914 hospitalizations right now. We want to make sure that we keep those hospitalizations down so that we can protect our hospital capacity. So that's an important thing that we want everybody to know about. So please help us by following those rules, using the tools, helping keep everybody safe and helping keep them healthy by not allowing the virus to spread. So we have also another opportunity to be able to fight the spread of the virus here in Nebraska, and that's called Test Nebraska. So obviously this is the service that the state provides to allow people to get tested. We have had over 500,000 people, individual Nebraskans, sign up for Test Nebraska, which is great. We've delivered 418,000 tests, and the tests are getting turned around in about 24 to 48 hours. In fact, in many cases, we're getting it less than 36 hours. So that's a great deal there. In fact, as many of you know, I'm in quarantine right now, which is why we're doing this by video. On Friday, I went to get tested through Test Nebraska. Was there at 11 a.m. on Friday, and I got my results back at 11:23 p.m., so about 36 hours to be able to get that test turned around, and the test came back negative. Now, I also want to point out, however, that you cannot test out of quarantining. So even though my test is negative, I'm still going to be quarantining for the next week to make sure that I didn't pick up the virus and the exposure that I had. So again, you cannot test out of quarantine. Also, we've been increasing capacity for Test Nebraska in a variety of different places. So for example, 2 weeks ago at Oakview Mall, we took the number of total tests up from 800 to 1,200. At our South Omaha location, we took it up from 300 tests a day to 500 tests a day. And at the North Omaha location, we took it up from 300 tests to 400 tests. Then on Friday, we expanded the hours at the South Omaha location again from, it was previously 1 p.m. to 6 p.m. We've taken that up now to 11 a.m. to 6 p.m. And the number of tests available there will go from 500 to 700. So expanding that testing at Test Nebraska. Next, what I'd like to do is remind people that we've got the different levels in at the hospitalizations that I announced on Friday. And we're going to be putting up a chart on the public dashboard later this week that will show that. As I mentioned, we had the hospitalizations come down a bit over the weekend and get back up to where they were before. And so we've got a chart that is going to be able to show the different levels of when we'll hit that red, orange, yellow, blue, or green levels. So with that, Ryan, can you put that chart up so people can get a chance to take a look at that? So this is that chart. You can see in the upper left-hand corner that the 914 is the current hospitalizations from yesterday, and the growth in the hospitalizations is in the bar chart there. And then you'll notice the lines that go across the chart. So the grid is how many coronavirus patients we have in the hospital. The top line is the red. That's where we'll be when we hit approximately 1,170 hospitalizations with coronavirus. That'll be about 25% of our hospital capacity. So we're doing it based on the percent. And so that number will fluctuate based upon our hospital capacity. The orange line is where we are right now. And that is with the current restrictions we have in place with regard to the 25% of venues and so forth. That's where we are right now. And then as we see those hospitalizations come down on a 7-day rolling average, we will be able to get down from orange into the yellow and then the blue. And then finally, when we reach 100 cases in the hospital per day, that's where we'll be at green. And that's where we were basically in July of this year. And that's when we'll have the least amount of restrictions in place. So as I mentioned, we'll have this chart up later this week. We'll continue to check in with this chart to see where we are and remind people that as those hospitalizations increase and we're getting closer to that 25% level, we're getting closer to more restrictions. So for example, the next round of restrictions, as we mentioned on Friday, restaurants will be limited in their operation from 5 a.m. to 9 p.m. Bars will be closed to all but carry out and takeout or delivery. They will not be able to have in-person dining. We'll be at the 10-person rule for those indoor gatherings, 25-person for outdoor gatherings. So you can see we'll be back at a lot of the same restrictions we had earlier in the spring. To avoid that, we need to keep those hospitalizations down. To avoid the hospitalizations, we need to keep the spread of the virus down. And that's where, again, everybody can be part of this by either using Test Nebraska, using our rules, avoiding the 3 C's. All those things will help make sure that we slow the spread of the virus and preserve our hospital capacity. Now, I mentioned some of the restrictions that we may be heading for if we see those hospitalizations increase. One of those I mentioned was on restaurants. We know that restaurants have been particularly impacted throughout the course of this pandemic. We had restrictions in place earlier this year that limited restaurants and bars as well with regard to their dine-in. We certainly have restrictions in place with regard to capacity on tables, only 8 people per table. Tables got to be 6 feet apart and so forth. While we have put these restrictions in place to help slow the spread of the virus, it has had an impact on our restaurants. We have seen permanent closures of restaurants and bars. We know that their business has been down, and this gives all of us an opportunity to be able to help out our restaurant industry here by getting takeout or delivery. Obviously, if you're quarantined, you're gonna have to do that anyway. But if you're not comfortable of going into a restaurant, please help support your local restaurants by ordering that takeout or delivery so that you can help those restaurants stay in business. We've waived some of those statutes with regard to alcohol, so restaurants can prepare, for example, alcohol to take with you as well. Maybe some margaritas from your favorite Mexican restaurant or something like that. That will help them out as well. To really talk a little bit more about this and what restaurants have been doing to help adapt to be able to help slow the spread of the virus here in Nebraska. And just kind of the overall view of how the restaurant industry is faring through this pandemic, I've asked Zoe Olson, who is the president of the Nebraska Restaurant Association, to come say a few words about how the restaurant industry is doing. So Zoe, if you could come up and please give us a few words about what you're seeing throughout the course of the last 7 months or so.
Thank you, Governor, and thank you for checking in on us. It's my pleasure to be the Executive Director of the Restaurant Association in Nebraska. Our members have been very diligent, as they always have been, in protecting the safety and health of both their staff and their patrons. We have some of the strictest health codes in the nation, and we follow them. And during this pandemic, not only have we done everything we used to do, but we're doing it more, and we're double timing. If you do go to a restaurant, you've seen things like face shields between the person who is, when you go up to pay perhaps, or you might see plexiglass screens, and we're doing every other place that you can sit at. What we're asking you to do, besides seeing that our staff are wearing masks, is that when you come in, wear a mask. Wear a mask. Wear a mask. If you think about it, our staff are in closer contact for a longer period of time with each other than they're ever going to be in contact with you. We need to protect our staff. They are our family. And we represent one of the largest employment sources in the entire state of Nebraska. We have staff who are concerned what's going to happen with their jobs if restaurants go down. And we are, as the governor said, we're vital to this state. So what we've been doing, we've been following the science. That's what we do. We have a dedication to keeping our consumers safe. We've always had that. And we have a renewed and stronger even interest in keeping our staff safe. We speak with medical experts. We don't talk to our cousin's brother's aunt's sister on Facebook to find out what the latest thing is. We actually talk to experts, and we do this virtually every day. We wear masks. We do studies. We do studies with the CDC, through our national association, with epidemiologists, with research universities throughout the country. And what they had developed was a new ventilation system for us, or ventilation recommendations for us, for our restaurants as we move back indoors. We take extra precautions. If we were sanitizing every 3 hours before, we're doing it every hour and a half now, okay? So we're doing more. It's important to note there has been no national outbreak of COVID-19 traced to a restaurant, and that includes Nebraska, because we're part of the country. Why is that? Well, it's behaviors, okay? When you go to a restaurant, you sit down, and now you're sitting no more than 8 people to a table, and you're 6 feet of distance from somebody you probably don't know. We ask you to wear a mask. And we ask you to only take it off when you're eating or drinking, and then put it back on. Would you do that in your own home? Probably not. You would invite your friends and family over, because your friends and family aren't going to make you sick, right? I have 4 adult children and their families, and guess what? They don't come to my house. If they do come to my house, and I have pictures of them on Easter picking up their Easter baskets, they're adults with their kids, they picked them up outside. They did not come in my house. I love those kids, but I also know that we're in different environments every day, and so we don't do that. When you go to a restaurant, you don't spend hours there. You might spend an hour, hour and a half, and you're not doing a lot of risky behaviors. Nobody goes to a restaurant and sits and eats nonstop for 4 hours. Well, probably nobody. But you might go to your friend's home and do that without a mask. You can't really socially distance in your friends' homes as well as you can in a restaurant. And so restaurants are a safe alternative. But we have restaurants that have never opened their dining rooms since they were closed. It was a business decision. They are now strictly takeout and delivery for the foreseeable future until we beat this thing. There are some that are going to close their dining rooms to indoor dining again for the same reason. It's a business decision. So what we'd like to ask everybody to do, follow the 3 C's and the W's. Wear a mask, wash your hands, keep 6 feet apart from people. And if you can dine, take your family to eat in a restaurant, we're only going to let you be there for an hour. And then you can safely leave and you can still have that family gathering. If you don't feel comfortable, do what I'm going to do. I generally overcook for the holidays. It's just going to be me and my husband this year. So I'm going to order out from a restaurant because they'll make it in a smaller portion than I would cook. And I'll save that big meal for when my family can all get together again. There are a lot of great offerings for family dinners and gatherings that you can take home and be in the safety of your own home. But please, only gather with people in your homes that you live with. Together, we can all fight this. And I do want to also thank you, Nebraska. When indoor dining was closed back in March, Nebraska was the 2nd per capita state in the nation for takeout, and you helped our restaurants survive. Right now, most of our restaurants are experiencing at least a 30% decline in revenues. When indoor dining was closed down, some of them were experiencing a 92% decrease in revenues. So please continue to do that takeout and delivery. We depend on you just as much as you depend on us. And continue to please do the right thing. Thank you.
Thank you very much, Zoe. Appreciate you coming in. And again, tomorrow can be Takeout Tuesday, so help support your local restaurants by getting that takeout. And Zoe suggested some great ideas there for the Thanksgiving Day holiday with regard to ordering out your meal. You can get it right sized for your gathering, and much smaller proportions you might order and make. I know if you make a turkey, you got a lot of leftovers there, but maybe you don't want that much, so maybe you can order out from a restaurant and get it delivered. All right. Well, thank you very much, Zoe. Appreciate it. And again, encourage Nebraskans to continue to get that takeout and delivery so we can continue to support our restaurants. Next, we'll go ahead and get into some of the questions that were submitted ahead of time. I got one here from Andrew Zaki from KETV. You asked, Dr. Antone, with community spread so great, is contact tracing still effective? Actually, I'm going to go ahead and jump in here real quick before Dr. Antone comes up and just say, actually, contact tracing is still important. What the goal is to reach out to the folks who have tested positive and really work with them on their case study to find out how they may have contacted the virus, but also get them to isolate, which means stay home until their symptoms have cleared and that they are safe to go back out in public. And then also being able to find out who else they may have been in contact with to get those people to stay home. The more that we get people who may have the virus to stay home, the less the virus will spread. So contact tracing is still very, very important. And that's why we at the state have trained over 1,000 people. We're ramping up the folks that are on the phone to be able to do more with regard to that. So we've got to do our contact tracing to be able to help people stay home and slow the spread of the virus. And then Taylor, I think you've got some other questions that were sent in ahead of time as well.
Yeah, we've had several come in. Julie Anderson from the World Herald asks, hospitals are nearing capacity, some rural ones are full and having difficulty transferring patients. Does the state have a plan to increase capacity if the remaining beds fill?
So with regard to the capacity, again, this is why we've got the chart that we displayed on Friday that will put more restrictions in as more coronavirus patients are in the hospitals. We've created a transfer center to be able to move patients from one hospital to another hospital. This is something that happens in normal times as well, but our transfer center will actually facilitate this. And we actually have a plan that is working with our regional health cooperatives to be able to transfer those folks either regionally at first, and then if that's not possible, to be able to move them in other places of the state. But we're really treating the state as one big hospital system. All the hospital systems have been very, very cooperative, just really demonstrating a great team spirit of working together, being collaborative, cooperating to be able to look out for the health of Nebraskans. So really the hospitals are cooperating very well. The other thing we did, as you may recall, is provide the additional $40 million to hospital systems to be able to go out and hire traveling nurses, more respiratory therapists, screeners for hospitals, pay hazard pay and so forth to be able to expand capacity that way. So those are some of the things we're doing. And then you may also recall that on Friday we limited inpatient surgeries, or those elective surgeries of the class D and E, and those are inpatient procedures that can be delayed. And so by doing that, that will also create more hospital capacity for us. So these are some of the steps we've taken to be able to increase the hospital capacity here in the state. And again, we can avoid some further restrictions if Nebraskans will follow our rules and use the tools we have to be able to slow the spread of the virus, avoid the 3 C's, wearing a mask when you go to the store, washing your hands, staying 6 feet apart. All these things will help us make sure that we slow the spread of the virus, get back into the habits that we had earlier this spring, and then we can flatten that curve and reduce the number of hospitalizations in our coronavirus hospitalizations in our hospitals.
Julie Anderson also asks, will local health departments be allowed to set their own directed health measures?
No.
Jeff Robb asked something similar. Why is the state withholding approval for individual health departments to do a local directed health measure?
Yeah, we allowed local health departments to roll out individual type DHMs earlier this year when the virus was spreading asynchronously. Now the virus has spread pretty much uniformly across the state, so we're going to have a statewide approach, and local health departments will not be allowed to do their own local DHMs.
And then Jeff Robb from the World Herald also asked, why are credit card signatures still required on restaurant takeout or delivery if you've given your payment information ahead of time? This might be something Zoe could answer. Zoe does not have an answer for it right away, so maybe we can follow up on that later.
Right. So again, I would say with regard to credit card signatures, though, I know in some cases when it's a low dollar amount, when I charge on my card, they don't ask for a signature. And so I think there's probably different limits that the credit card companies have. This is really probably more of a national issue, not a state issue.
Don Walton asks, healthcare professionals have been asking for stronger restrictions now rather than waiting. What do you have to say to them?
Well, again, we published our chart with regard to hospitalization capacity, and we are about 20% capacity, or 20% of our cases in our hospitals right now are coronavirus. As we reach that 25% level, then we will be putting in more restrictions. So Nebraskans have the opportunity right now to be able to really adopt some of the habits we had in the spring with regard to, shopping once a week, going to the store by yourself, helping kids socially distance, and wearing your mask when you're going into the store, and all those sort of things. And if we can slow the spread of the virus, then we can avoid those further restrictions.
Chris from NTV asks how you feel about a vaccine being so close, and will the military help distribute it?
So good news on the vaccine front. Looks like from the news that Pfizer and Moderna are both either 90 or 95% level of effectiveness, which is great. I do want to remind people, though, that even if we start getting that distribution next month, that it will be prioritized to our healthcare workers, to long-term care workers, to people who are going to be more vulnerable to the virus, older people with underlying health conditions, minorities, and so forth. And that it will take time for that production to ramp up so that it's available to the general public. I believe that the federal government had said that widely available to the general public, sometime maybe April, and maybe sooner, but again, it just kind of depends on how this all rolls out. We will be distributing the vaccines through our Vaccines for Children program. That's an existing program that's set up, that VFC program, and that is the infrastructure we have in place. And then my understanding is also some of these vaccines will be going directly to the hospitals for distribution as well. We can actually, if that would be something of interest, we can get our DHHS people to come in and go over in more detail what the vaccine distribution plan will be. Certainly as we get closer to the end of the month and it looks like we're going to have a vaccine, that would be something that I think would be of more interest.
Chris also asks, are you concerned about families returning home for Thanksgiving?
Am I concerned about families returning home what, Taylor?
For Thanksgiving.
For Thanksgiving. Well, again, we're really encouraging people this year for Thanksgiving to not have the big family get-togethers you may have had in the past and break it up into those smaller individual families to be able to help slow the spread of the virus. Again, one of the things we've talked about, our local public health directors indicate that the virus spreads, from person to person, right? And it's been those informal gatherings where people are, at their friend's house or something like that, where we've seen a lot of the virus spread, where we don't have the structure of, say, a business or a school where, we've got the rules in place about staying 6 feet apart and wearing your mask and all that sort of good thing. Thanksgiving would be better if you just kind of keep it smaller, keep it to, your individual family groups and so forth. That will help us slow the spread of the virus.
Bailey Bischoff from 1011 says the Board of Education just released a recommendation for a statewide mask mandate to limit spread and keep schools open. What would it take for you to support a mask mandate?
So we're asking people to use masks in the cases where masks are appropriate. If you're going to be closer than 6 feet for more than 15 minutes, that's in our latest DHM for all businesses to have that, who have staff and patrons closer to that, to do that. And that's the appropriate use of masks. And then, of course, we want to educate people about those use of masks so that if you are going to be within 6 feet of somebody for more than 15 minutes, you should wear a mask. And that's part of the education process. But we're going to decline to do just a broad-based statewide mandate such as they're referencing.
Secondly, Bailey asks if a mask mandate would improve compliance with mask wearing and therefore reduce community spread, would it be worth it? Why have you been so firmly against it?
So again, we want people to be educated about when to use a mask. We want people to start using them, just when you're going to be in that situation where you're going to be 5 feet or 6 feet apart and for more than 15 minutes, you're going to be close like that. That's the appropriate use of a mask. And just a reminder, folks, that, even with the vaccine coming out next month, we're going to still be needing to use these rules for the next several months ahead. Certainly through much of the first part of next year, we're going to need to continue to follow all these rules about, wear your mask when you go to the store, wash your hands off, and stay that 6 feet apart. So these are things that aren't going to be done away with quickly. We're going to need to all learn how to use the tools that we have, use them effectively, and continue to use them for the next several months.
The final question from Bailey is, has demand for tests through Test Nebraska increased in the last few weeks? Do we have any data on that?
The question has been, has the demand for Test Nebraska increased over the last several weeks? I don't have any data for you, Bailey, with regard to the number of tests we've done on a weekly basis, but we can get that data for you and let you know. Obviously we're expanding the test slots, so I expect we will see that we're doing more from Test Nebraska. I just don't have that data at my fingertips right now.
Tara from WOWT in Omaha says the Nebraska State Education Association held a press conference this morning calling for you to enact more coronavirus restrictions. They say without more action to slow the spread, schools will have to close. Will you consider taking more actions to protect schools?
So again, we published our chart on Friday with regard to how we'll have additional restrictions. As we've said all along throughout this pandemic, it's really been about managing our hospital capacity. And right now, as we mentioned, we're at 20% hospital beds, 30% ICU beds available, and we can avoid further restrictions if Nebraskans take the step to slow the spread of the virus. And when we hit 25% of our hospital beds being taken up with coronavirus patients, we will see additional restrictions.
We've had a few questions from Joanne Young, Ruda at CAM-TV, and I believe Paul Hamill as well at the Omaha World Herald, asking about a press release that Senator Justin Wayne put out. He's saying that cities have the authority to enact mask mandates because of state laws that allow regulations for preventing the spread of contagious diseases and for regulating nuisances in cities. Do you have any response to that?
Well, again, I think we've addressed this in the past. Certainly, we know that Omaha has that ability because they have the home rule charter. And for any other city who's looking at that, I would certainly reference you to your legal counsel to make sure that. I don't know that it's just automatically guaranteed for every city to be able to do that, such as Senator Wayne is suggesting. I'd certainly recommend cities consult with their legal advisors before they do something like that.
Andrew Ozaki has a few questions. One is, what kind of financial assistance will be made available for pharmacies, especially in rural areas, to purchase the refrigeration equipment needed to store the vaccine? Is there any federal help on the way?
So with regard to the vaccination plans, I'm sure the federal government has plans that they've got in place with regard to the super cold, because that is something that's probably going to have to be delivered directly on dry ice to the providers who are going to be delivering those vaccines. And with regard to the other colder storage, many of our local public health departments have those facilities as well. So I have not heard anything specifically about the federal government buying additional refrigeration units, but I know that they've got a plan with regard to that super cold to deliver it in dry ice in doses that will be used immediately so that it continues to stay good.
Andrew also says some bar owners are telling him that their business dropped off 75% this weekend. Their employees are fearful they will be laid off. Some owners are even considering shutting down. Is there anything more that can be done to help business owners such as bar owners survive?
Well, again, this is where we encourage Nebraskans to be able to do that takeout delivery, the to-go orders. Certainly you can still do that from bars and restaurants. And that'd be a great way to be able to help out our local bars and restaurants and keep them in business. And then, we'll just have to wait and see if the federal government is going to do any additional programs with regard to this, as we've seen, additional cases rising all across the upper Midwest here.
Andrew's asking about a video on Twitter showing a number of UNL students tailgating without masks. Have you seen or heard about this video, and what is your reaction? He's asked, why isn't your message about the 3 C's getting through to these people?
So I have not seen the video that Andrew is referencing, so I can't speak to that one directly. But again, this is why we published our Avoid the 3 C's campaign several weeks ago. This is how the virus spreads from one person to another, and we can slow that down by keeping that 6 foot of distance between ourselves and others when we go in public, wearing a mask, washing your hands, staying home when you're sick, go to the store once a week, go by yourself. These are all things we can do, and I think it is an education process. So this is where we need to continue to, get the message out. The state itself is paying for a communications campaign, so we are trying to get that message out to folks. But I think everybody can take a hand in that too, and talk to your friends and family and neighbors about the importance of trying to slow down the spread of the virus by keeping that 6 foot of distance and avoiding the 3 C's.
Melanie from the York newspaper asks, when and if the heightened restrictions for coronavirus are put in place, how long will they last for? Will they last for a month, or will they only last until the hospitalization situation goes back under 25%? Will it have to remain under 25% for a certain amount of time before the restrictions are loosened?
Yeah, so if we were to hit the 25% level, we would be able to get out of that or loosen up those restrictions once we had a 7-day rolling average below the number where we would hit that 25%. And the same would be true for the orange level and so forth. In fact, that was really getting back at that idea of that chart we just published, that you see the red line, the orange line, the yellow line, the blue line, the green line. As we get our number of people in the hospitals below that level for a 7-day rolling average, so not just 1 day down, it's got to be, 7-day averages, rolling average has got to be below that number. Then we will reduce the restrictions that were appropriate to that level.
We have a series of questions from the Custer County Chief. When someone from Custer County has to drive more than 90 miles to Minden to get a test, it seems that testing is not as widely available as hoped. Why should anyone in Nebraska have to drive more than an hour, especially with winter weather coming on, to get a test?
So with regard to Test Nebraska, what we do is we look for providers who are willing to do the program. And so that means we have to have providers that are willing to do it. We actually have one in Ord, so you don't have to go all the way to Minden to be able to do that. And we just recently signed an agreement with a provider in Burwell, so we'll be able to offer another option there. So we are looking to be able to expand the number of options. Again, it's kind of dependent on having providers available to be able to do that. And then, of course, there are other clinics and so forth that are doing it beyond Test Nebraska, though I would certainly caution people that, or at least give people a heads up that other providers may be charging you for that. So please check with them beforehand. Test Nebraska is free to anybody who wants to use it. We don't share your data with anybody. So a great option there, but we certainly want to make it as available as possible, but a lot of it just depends on making sure that we have the providers available to do as well.
Their second question is, at Test Nebraska, local hospitals and public health departments are operating independently rather than together, or are they working with one another?
I'm sorry, can you say that again, Taylor, please?
With Test Nebraska, are the local hospitals and public health departments operating independently of one another, or are they working together on this initiative?
So with regard to Test Nebraska, that is a program that is run through the state. And so we are coordinating the Test Nebraska programs with the various providers. I think that's what you're getting at. I'm not sure what the question is if it's not that. But as I've said, other providers have other ways of doing testing. So there may be other programs that are out there.
Their next question is, it's said that testing doesn't cost the patient. However, we've been told that testing is free only through Test Nebraska. If a person is tested through other channels, there's a cost. Is that true?
Yeah, absolutely. That's what I would just cover. So other providers are providing testing, and they may be charging for that. So that's why you need to check ahead of time with your provider before you do it. But Test Nebraska is free.
And the last Custer County chief question is, a person who was tested last Tuesday didn't receive confirmation of the results until Sunday. How do we continue to encourage people to get tested when testing is not readily available? There's fears of there being an expense to it, and the turnaround time can be several days.
Well, again, Test Nebraska is always free. So if you want to get tested there, you will not be charged. And with regard to the turnaround time, this is something that we continue to work to make sure. I shared my own experience with the Test Nebraska lab where it was a 36-hour turnaround. And if we actually shared, I think we have on the public dashboard, if you go look, you'll be able to see what the average turnaround time is for all the testing folks. I think on the dashboard today or yesterday, the Test Nebraska was at 1.7 days. So in general, we've been getting those tests turned around in less than 48 hours. That is an average. So sometimes people's tests, for whatever reason, may take longer. But the vast majority of Nebraskans are not experiencing the type of turnaround time that's, at least right now, longer than 2 days.
Ruta from KMTV has a few questions. She says different medical associations and organizations have signed a plea for Nebraskans to take more precautions. Young adults are still going to bars, not wearing masks. What about your message do you think is not getting through about taking extra precautions?
Well, I would say it was just really the same sort of thing that when Andrew was asking about earlier, that, it's an education process. We need to continue to remind people that, the virus is spreading in our community, that we're seeing more community spread, and that our hospitalizations are increasing. On September 23rd, we had 200 people in the hospital with coronavirus. As of yesterday, we had 914 people. So that's in a period of just a little under 2 months, we've seen that go up more than 4 times. So we do need Nebraskans to step up and really follow the rules that we've said, use the tools we've given them to be able to slow down the spread of the virus here. And that's what we just need to continue to get that message out. That's why the state's got paid for a public relations campaign out here. We're buying media and using digital and so forth to be able to get that out, as well as through the news media and so forth. But all of us can have a hand in this by talking to our friends and families and saying, hey, we all got to be a part of this. Wear your mask when you go to the store, avoid the 3 C's. These are all things that will help us slow down the spread of the virus.
And then her second question is, there have been around 139 coronavirus deaths in Nebraska since the start of November. In September, that number was under 10. Can you explain to people what happened from September to November, and why do you think deaths and hospitalizations have gotten so much worse?
Yeah, I think that, as we've seen the weather cool off and people are going indoors more, that the virus, again, has more of a chance to spread. That's one of the reasons why we talked about having good ventilation in your household. One of the reasons, for example, with our the COVID meat processing handbook, one of the things that was stressed is that good ventilation is important. When the folks from UNMC go into an on-site visit, for example, to some of those meat processing plants, they talk a lot about ventilation. So as we go indoors and we've got poor ventilation, then the virus has a better chance to spread. So we've seen more spread. That's why we've seen more cases throughout September, October, and now into November here. As more people get it, more people are going to be hospitalized, and then we're going to have more fatalities from it. So this is why we need Nebraskans to really step up and start slowing the spread of the virus so we can preserve our hospital capacity. Our healthcare professionals are working very, very hard. We need to help them out by stepping up and doing the things we know will slow the spread of the virus, like washing your hands and staying home when you're sick and all the other rules that we have, avoiding the 3 C's. We can all be a part of making sure we're slowing this down.
Ruta's last question is, what is the state's plan if hospitals run out of beds?
Well, again, this is why we have the restrictions put in place so that we're slowing down the spread of the virus. We still have 20% of our hospital beds available, 30% of our ICU beds available, but we have seen that the number of patients in the hospitals from coronavirus is increasing. And so we need people to slow down. That's why we've done all the other things with regard to, again, the $40 million to help bring in additional staff, to also pay hazard pay, all those sort of things, the transfer center, are all we're doing to preserve that hospital capacity right now here in our state. So that's really the plans that we're using right now to be able to increase that hospital capacity and make sure we continue to manage it.
We have a couple more follow-up questions. Julie Anderson says, so are the hospital capacity levels based on a 7-day rolling average? I thought the chart on Friday said a 14-day rolling average.
So our hospital capacity is based on a 14-day rolling average. The number of cases for coronavirus that will allow us to drop back down to the next level, that will have to be a 7-day rolling average. So you're comparing the 7-day rolling average of coronavirus cases in the hospitals versus the 14-day rolling average of hospital capacity. Because the hospital capacity, again, these are staffed hospital beds, so that staffed hospital beds can vary depending upon the amount of staff that are available. So again, that's why that's a 14-day rolling average. The cases will be based on, or the hospital cases will be based upon the 7-day rolling average.
Tom Becca from Fox 42 says, is the governor as philosophically opposed to other public health measures like mandated seatbelt use or no smoking in public buildings as you are against a mask mandate?
Well, again, all these things are things that require education with regard to it. Some of those other things were already put in place. For example, I have been opposed to making the seatbelt laws a primary offense. It is now a secondary offense. So again, I think we need to educate people about the tools we have to be able to slow the spread of the virus, and that's what we're doing. And remember, for example, masks are just one tool. They're not the only tool. We need all of our tools. This gets back to that Swiss cheese analogy that we talked about earlier in the spring, how not one thing was going to protect us from the pandemic. Not one thing is going to slow it down. We need a variety of different tools overlaying each other to be able to make this happen. So wearing a mask when you're closer than 6 feet to somebody for more than 15 minutes is one of the ways we can do it. But we also need people to wash their hands often. We need people to be able to keep that 6 foot of distance between you and other people where possible. Avoid the 3 C's. Stay home when you're sick. That's a big one. Good ventilation in rooms. All these are different layers of that Swiss cheese will help slow down the spread of the virus. And that's what we really need. All those things that go over, do all these things to be able to help us slow down the virus. And that's how we're going to be able to slow it down. So it is a multi-layered approach. One thing like masks is just not going to be sufficient by itself.
Both Bailey Bischoff and Andrew Ozaki have a follow-up question that's very similar. If the education process isn't working, if people aren't increasing mask wearing or social distancing, does something different need to be done at some point?
Well, again, as I've traveled around the state, obviously before I got quarantined, what I was saying was that mask wearing was increasing. Now, again, we've got more work to do, but I saw as I traveled around the state, people were adopting the use of masks. So I think it just gets back to continuing to do the education process. And remember that it does take time to get that message out, and we can all be a part of making that message out there. Media outlets, for example, can take our PSAs and put them out there in the public to help get people to adopt that. We can talk to our friends and families, so everybody can be a part of helping to educate our neighbors about using all the tools we have to be able to slow down the spread of the virus.
Before we go to questions in the room, Zoe Olson has a follow-up on the credit card signature issue. If you want to come up, Zoe.
All right, great, thanks.
So I checked with my experts, my banking friends, and they said there's 2 things. One is habit. Certainly, if you've been through drive-thrus or a lot of restaurants, you see contactless payment where they push a machine out to you, you push a card and you take it back. The other thing is hardware issues. Some systems have not been updated yet, and that's why they still require a signature. So it's a kind of a two-part thing.
Great. Thank you very much, Zoe. Appreciate it.
Question, Fred?
Well, I don't know whether this is for the governor or Zoe, but she said there wasn't any outbreaks traced to restaurants, but the University of Minnesota Center for Infectious Disease Research and Policy study found that people who tested positive were almost twice as likely to have reported going to a restaurant than people who didn't. So doesn't that mean that going to a restaurant is inherently dangerous?
No, I'm going to, so the question is, a modeling study said that people who tested positive had gone to a restaurant. Doesn't that show that going to a restaurant is inherently dangerous? Is that your question, Fred?
I don't believe it was a model. I think it was a study of people who had tested positive, and they said they were twice as likely to have reported going to a restaurant than people who didn't.
And what else did they report? Yeah. So we also had a study come out from, and it is kind of a modeling study. It is actually. Stanford did a modeling study as well. So I'm going to reject that premise. They model off trends. The Stanford study modeled off data of cell phone usage from March to May 2020. Just like polls, probably we found polling is not as accurate as we think it could be. Modeling is not either. When you're modeling, and when they're looking at, they ask these people, did they ask the people, were you wearing a mask? Did they ask the people, were other people in the restaurant wearing a mask? Did you always wear a mask? What else did you do? Simply saying, I went to a restaurant at some point, and I got coronavirus, there's not a direct causation line there, and I don't think there's any scientist that would tell you that there is a direct correlation there. Thank you.
Any more questions? Martha, you got anything? Brandon?
I guess there's Zoe again, sorry.
Okay.
Can you kind of give the perspective of what you're hearing from restaurant owners after, some had to close down at the start, some survived, and now some wave two again, and kind of the message you're hearing, the morale, I guess.
Okay, so what am I hearing from restaurants owners when we had to close our indoor dining? Some have closed permanently. What is the morale like? Again, I say it's very humbling to work in the hospitality industry. I've never seen a harder group of people who want to help each other and who want to help the public and others. I know I've talked about it before, how even though we're going through these tough times in the restaurant industry, we're still doing things like supporting our food banks and feeding hungry people and doing coat drives and doing all we can to be a part of the communities that we belong to. I will tell you that the owners, the workers, the staff, there is fear, and fear sometimes comes out as anger. But mostly we're exhausted. But we also have a very strong work ethic, and we have a lot of can-do attitudes. So again, you can't say that one restaurant is exactly like another restaurant. One business owner is not going to make the same choices another business owner is going to make. But I know that they're all working diligently to keep serving people, to keep these businesses that they built, to remain an active part of the community. And again, we're seeing, as I said before, sales are down overall. What I'm hearing is about 30%, so revenue's down about 30%. We can make it for a time on that. We can continue on, but we're tired, we're stressed. And the other thing I hear from my members is to say, Please be kind to our staff. Whether or not you agree with what we're doing in our businesses to keep our staff and you safe, please be kind to our staff. Whether or not you agree with health measures, please be kind to our staff. Our staff are stressed. We're coming to the holidays, and as you heard earlier, we have staff who are concerned about what's this going to look like for their income, for their livelihood. Please be kind and continue to use our services. Thank you.
Any other questions? Martha?
Now I will ask a question. This is for the governor. Are you ready yet to?
We're getting some, hold on a second, sorry. There we go.
Are you ready yet to acknowledge Joe Biden as the president-elect?
When all the legal challenges have been resolved, then that I think would be the appropriate time to do that. Martha, thank you.
Any other questions?
Yes, Governor, follow up to Andrew's question about the video of the college students tailgating. Obviously, you didn't see the video, but what would your message be specifically to college students who are adhering to the DHMs selectively? What would be your message specifically to college-age students who want to enjoy the college experience, but understanding that's not possible at this time?
Yeah, I know. I know it's tough because especially if you're a senior, this has got to be very disappointing that your senior year is being impacted by this coronavirus. I understand. I've got a couple of college seniors right now myself, so I know this is a tough time. And we just all got to do our part to be able to slow down the spread of the virus and to be able to, use the tools that we have to be able to do that. And it includes doing the social distancing, keeping that 6 foot of distance between you and other people, wearing a mask when you can't do that, washing your hands off and all those sort of things. Staying home when you're sick. I know sometimes college students feel invincible and they don't want to necessarily take time off when they get sick, but that's going to be important for everybody as well. And remember that this virus spreads from one person to another, so those social gatherings are the places where this virus is going to spread. And while many young people will not be impacted by this as severely, you still can be. I think we had, Steve and Ann Schrader last week, and Anna said that, remember, you're playing Russian roulette here. While maybe the vast majority of people who are in college age are not going to be the impact, some people in that college age group will be severely impacted. You don't want to be that person. So, and also, even if you're not that person, you could spread it to somebody who is one of those vulnerable people. So please remember that, especially as we're getting ready to go home for the Thanksgiving Day holiday, to take a special precaution so that you don't become infected with the coronavirus and then take it home and spread it to your family members who may be more vulnerable. I think there's a lot of good reasons why, as difficult as this may be for our college students, we all got to step up and do the right thing here to slow the spread of the virus.
Other questions? All right, well, seeing none, Governor, did you have any final thoughts?
Yeah, I just want to wrap up by saying, again, we want to remind people to avoid the 3 C's, use all the tools we have. We will have another press briefing tomorrow at 2 p.m. and then on Thursday at 10:30 a.m. we'll be announcing more communication with regard to getting the message out there about following our rules and using the tools and avoiding the spread of the virus here in our state. And again, everybody can be a part of this. We've got lots of opportunities to be able to educate our friends and families and neighbors about slowing the spread of the virus, keeping our hospitalizations down. All of that does take every Nebraskan to pitch in and take care of each other. So please, everybody be a part of the solution here, and we'll look forward to talking to you all again tomorrow. Thanks very much.